Hi Sherry, it's Allie Johnson, and it is November 12th, and I'm going to do my leg, ankle, and foot palpation video. So to start, the tibialis anterior originates on the lateral condyle and lateral proximal aspect of the tibia. It inserts on the first cuneiform and base of the first metatarsal. It does dorsiflexion and inversion. The extensor digitorum longus originates on the lateral condyle of the tibia and the proximal 3/4 fibula and interosseous membrane. It inserts on phalanges 2 through 5, and it does 2 through 5 toe extension and ankle dorsiflexion. The extensor hallucis longus originates on the middle 1/2 of the fibula and interosseous membrane. It inserts on the base of the distal phalanx great toe, and it does great toe extension and ankle dorsiflexion. The peroneus tertius originates on the distal 1/3 of the fibula and interosseous membrane, and that does it inserts on the dorsal aspect of the 5th metatarsal, and it does ankle dorsiflexion and eversion. On the lateral compartment, we have the peroneus longus, which originates on the lateral tibial condyle and head of the 2/3 proximal fibula. It inserts on the base of the first metatarsal and first cuneiform, and that does eversion and plantar flexion. The peroneus brevis originates on the distal 1/2 of the fibula and inserts on the styloid process of the 5th metatarsal. That does eversion and plantar flexion. On the superficial posterior compartment, there's the gastrocnemius, which originates on the medial and lateral femoral condyles. It inserts on the calcaneus via the Achilles tendon. It does plantar flexion. The soleus originates on the head and proximal fibula and middle tibia. It inserts on the calcaneus via the Achilles tendon and does plantar flexion. The plantaris originates on the linea aspera of the femur. It inserts on the calcaneus and does weak plantar flexion. The deep posterior compartment has the tibialis posterior, which originates on the middle posterior tibia, medial aspect of the fibula and interosseous membrane, and inserts on the navicular, medial cuneiform, and metatarsals 2 through 5. That does inversion and plantar flexion. Then the flexor digitorum originates on the posterior tibia. It inserts on the base of the distal phalanges 2 through 5, and that does toes 2 through 5 flexion. The flexor hallucis longus originates on the posterior fibula and interosseous membrane, inserts on the distal phalanx of the great toe, and does great toe flexion. The anatomical landmarks of the femur is the medial and lateral femoral condyles, which are located medial and laterally of the superior tibia. The tibia has the tibial plateau, which is just inferior of the patella. The tibial tuberosity is inferior to the tibial plateau, and medial and lateral condyles are found on the opposite sides of the knee. The Gerdy's tubercle of the tibia is on the lateral side. The shaft of the tibia runs all the way down to the bisects of the malleolus of the ankle and all the way up to the tibial tuberosity. The medial malleolus is on the medial side, superior to the arch of the foot, and the popliteal line is on the anterior portion of the tibial shaft. The fibula has the apex, the head, neck, shaft, all the way down to the lateral malleolus, which is inferior to the medial malleolus. The talus is a dorsal bone of the foot that articulates with the tibia, fibula, and cuboid bone. The calcaneus is also known as the heel bone. That has the system tachium tali, which is the bump that is lateral on the foot, and the medial tuberosity. Then there's the navicular tuberosity, which is anterior to the talus on the medial side, in line with the great toe. The cuboid is on the lateral side, in line with the fifth metatarsal, roughly. Then we have the cuneiforms, which is just inferior of the talus and superior of the metatarsals. We have the medial cuneiform, the second cuneiform, and then the lateral cuneiform, which are first, second, and third. And then we have the metatarsals. They articulate proximally with the tarsal bone and distally to the 5 phalanges of the foot. Each metatarsal has a head, a shaft, and a base, which is proximal. And then there's a styloid process of the 5th metatarsal, which is on the lateral side of the foot. It's just this little projection that sticks out. The proximal phalanges, which articulate with the distal phalanges to form the distal interphalangeal joint. Each proximal phalange have a head, shaft, and a base. The middle phalanges also have a head, shaft, and a base, and the distal phalanges, which is the very tip of your toe, have a head, shaft, and a base on all 5 phalanges. The 2 sesamoid bones of the foot are located on the ball of your foot, just under the great toe joint. The proximal tibiofibular joint is a plain synovial joint that does dorsiflexion. It is located between the lateral tibial condyle and the fibular head. The talochoral joint connects bones of the leg, the fibula and tibia with the talus of the foot. It is a modified hinge joint at synovial, and it does dorsiflexion and plantar flexion. The distal tibiofibular joint articulates with the distal end of the fibula to form the tibia and fibular joint. It is a syndesmosis immovable joint that's fibrous, and it does dorsiflexion. The subtalar joint articulates with the talus and the calcaneus. It is structurally a plain synovial joint, and it helps with inversion and eversion. The metatarsal phalangeal joint articulates with the bones of the foot to the proximal phalanges of the toe. It's a condyloid synovial joint, and it helps with flexion, extension, abduction, and adduction. The proximal interphalangeal joint is located between the base of the middle phalanges and head of the proximal phalanges. It's a hinge joint and it does flexion and extension. The distal interphalangeal joint is at the distal portion of the phalanges of the toes. It's a synovial hinge joint and it does flexion and extension of the toes, or prevents. The anterior tibiofibular ligament holds the two lower leg bones together of the tibia and the fibula. It holds the tibia and the fibula together and the lateral malleolus in contact with the tibia. The anterior talofibular joint is lateral and it is near the posterior talofibular joint. It is the most common ankle sprain of the outside of the ankle, and two movements of anterior sliding of the foot and the ankle of inversion and plantar flexion. The calcaneofibular ligament runs from the lateral malleolus slightly back to the lateral surface of the calcaneus. This protects the lateral slide of inversion and helps maintain the medial longitudinal arch of the foot. The deltoid ligament is a medial ligament which attaches to the posterior borders of the medial malleolus, and it prevents eversion, helps stabilize the medial side of the ankle. The spring ligament helps connect from the calcaneus to the navicular, also known as a calcaneonavicular ligament, and helps restrain of the medial longitudinal arch. The Achilles tendon is where the gastrocnemius and the soleus has a place of muscle attachment and helps transmit power from the calf to the heel of the foot. The plantar fascia is the most superficial. It's a place of muscle attachment. It's fibrous tissue and it prevents excessive dorsiflexion. The interosseous membrane is in between the tibia and the fibula. It's structurally very strong ligament in the body. It helps stabilize the tibia and fibula. And that is my leg, ankle, and foot palpation video. Thank you.